Today on Town Hall.
We're estimated to produce 30% of the world's data. Hospitals like yours and mine are estimated to produce 50 petabytes of data each year. Like, that's equivalent to streaming a 2-hour movie 25 million times.
My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Town Hall show is designed to bring insights from practitioners and leaders on the front lines of healthcare. All right, let's jump right into today's episode.
Welcome to another This Week Health Town Hall conversation. I'm Reid Stephan, CIO of St. Luke's Health System in Boise, Idaho. And today I'm joined by Dr. Spencer Dorn, who is a gastroenterologist and the Vice Chair and Professor of Medicine and the lead informatics physician at the University of North Carolina. That's a lot. Spencer, thank you so much for making the time for a conversation.
Yeah, awesome to be here. Thanks so much, Reid.
Okay, we're going to try something, an icebreaker game. I'm going to read you 5 recent, within the last month, AI-themed headlines. And then based on your expertise and your own personal crystal ball, you're going to let me know if you think the headline today or in the future is going to be fact or fiction.
Okay, I don't get the hedge. I got to pick one or the other.
That's right, one or the other. Even though you could argue like down the middle, but I'm going to force you to take a stand.
Okay.
Headline number 1. AI will improve patient satisfaction scores more than any current initiative.
That's a hard one. There's so many other initiatives. So I'm going to say, I think AI will improve satisfaction. We're already seeing it with scribes and their people like their doctors are looking up in their keyboards, but that's a high bar to clear. So I'm going to say fiction.
Yeah. And these titles, I think, are intentionally provocative. And so that may be kind of hard, but I'm with you. Headline number 2. ChatGPT diagnoses are more accurate than physician diagnoses.
There are some studies suggesting that ChatGPT outperforms physicians in some experimental settings, but I think in the wild, I'd still call that fiction today.
Number 3, hospitals will need a chief AI officer by the year 2026.
I think I would call that false or fiction.
Yeah, I'm with you on that one.
AI is different technology, but most hospitals, health systems already have pretty robust governance for their digital technologies, and I think often those suffice.
Agreed. Okay, the last 2, and these are related in terms of enterprise DNA. Microsoft CEO, Satya, current CEO, admits that AI is generating basically no value.
Well, it's hard to argue with him. He sees I think it's hard to show the value, and I think a lot of the value has not yet been proven, but I think I'd call that fiction. I think there's more than just hype. Yeah. There's a lot of hype. It's overblown, but I think there's some substance, so I'd call that fiction.
For sure. Okay, former Microsoft CEO Bill Gates says that AI will replace doctors in the next 10 years.
Yeah, I think that's a big fiction, false.
This is fascinating because here are these 2 gentlemen that have this shared, corporate DNA. And clearly, especially with Bill, I think he's trying to be provocative. I don't even know if he believes that, but it just speaks to the landscape that we're in. And those kind of headlines and positions make it challenging for folks like you and I to kind of navigate and help steer the conversations in our respective organizations.
Definitely.
So on that theme, you wrote about this kind of spectrum of AI belief in healthcare. On one end, you have the doomers, like those who feel like we've kind of entered end of days, robots are going to take over. On the other end, you have the zealots, the unbridled enthusiasts who can't get there fast enough and it's going to improve everything. In your walk of life, what have you found that kind of drives the mindset in each camp? And what can we learn from that?
Yeah, it's really interesting, Reid, because I think in many ways, it just reflects human nature. As human beings, we tend to align ourselves with certain core beliefs or certain groups of individuals. And unfortunately, we naturally like to separate ourselves, what some people would call, we like to other people. They're not like me, they're others. Yes. That's kind of human nature. So we like to align in different camps. And, one popular camp are the techno-utopians. And they see how technology has changed various aspects of our lives, often for the better. And they want to bring those opportunities and benefits to health and healthcare. So they're super charged up about this, and they just see a really bright future for AI in healthcare. And then conversely, we have the cynics who see healthcare as this unmovable force, and they're deeply disappointed by the effects of digitization. They feel like it's actually created paradoxically more work or It's maybe disconnected us more. And often the people in this camp are nostalgic for this earlier, more romantic era of medicine. Whether it was truly more romantic or not is debatable. And they appreciate that healthcare's deepest problems are really not technical. They're more social and political and economic. So we see these two camps, and I think there are valid beliefs held by both camps. But in general, I think that extremist views are typically wrong. And I tend to gravitate towards the middle ground, recognizing there's great opportunity and this stuff is hard and technology will not necessarily fix all of our problems.
Yeah, well said. I'm with you. I try and find that meaty part of the bell curve, and somewhere in there is a version of the truth that's more pragmatic. And, as the CIO and your role as a physician leader, we have to be psychologists, sociologists. You have to figure out, how do you thread that needle of inviting the skepticism that's healthy and useful, but doing without freezing innovation or analysis paralysis. That's the art of what we do. It's kind of fun, actually. I enjoy it, but it's not easy.
That's true. Well, great leaders like you are thinking about the human aspects, right? Usually it's not that, obviously you need to know what's happening technically, because that's what your main responsibility is, but it's really about people. At the end of the day, healthcare is about people. It's the people that we're caring for. It's the people that are doing the work and our teams, and people are complicated. And large organizations of people are even more complicated. Very little of it is about the technology itself, and much more of it is about how the technology fits into this broader system. And we made the mistake with EHRs of thinking that, we're just going to adopt these things and everything will be fixed and everything will be great. And overall, I think EHRs have gotten a bad rap. I think EHRs have brought a lot more good than harm, but they haven't necessarily lived up to these, grandiose promises that were made and projected back in the early 2000s. And I think it's largely because you can't paint this Pollyanna-ish picture, right? We can't oversell technology, because it's really, again, at the end of the day, not about the technology. It's about how we implement it and the people using it, hopefully for good.
Yeah, I completely agree. And it's such a human nature condition to want to oversimplify, to deconstruct it really quickly and find that solution. And it's not that. Your comment about people being complex, organizations being complex. If I take my family of 6 out to dinner, it's a challenge to figure out, where do we want to eat? Can we find a place we all like? Now think about a 17,000 employed organization trying to align on things. It's going to be hard, and we shouldn't be surprised or discouraged when it is hard.
To add to that, I think we also need to recognize that no one has a monopoly on all the good ideas, right? There's no one walking around in your organization who just is always correct, knows everything. I think speaking to people on the ground is usually a good thing. And you want different views, right? You want to hear competing interests and different perspectives. You want to hear the doomers, and you want to hear from the, techno-utopians, because each carries some information and perspective that's worth listening to. But I think ultimately our job is to figure out, how do we embrace nuance, and how do we communicate clearly a vision that's grounded in reality, not just hype or not just, unreasonable doubt.
In one of your recent posts, you talked about, and this is not a new concept, but you emphasized that technology adoption is often a people and process challenge, not a technology challenge. And I think we all instinctively know this, yet, and speaking for myself, we continue to maybe underemphasize or miss that point. So with that in mind, what are health systems getting wrong about implementing AI?
It's still so early, so it's hard to say what they're doing wrong. I think health systems are doing a lot of things right. I think, for one, health systems are taking this seriously and recognizing that AI is different than prior versions of software, and working hard to set up the right governance and monitoring framework so that whatever tools they use responsibly and for the benefit of patients in the workforce. I think one thing maybe some are getting wrong, it relates to what we discussed a minute ago of this kind of overpromising that technology will fix the problems in medicine. And, really, again, failing to learn from our experience with electronic health records, which are billed as this kind of panacea for all that ails healthcare. But the belief that technology will necessarily improve care really is no longer credible. And so I guess I would suggest that maybe some organizations are overselling the technology. There's great opportunity, but I think we need to stay grounded in reality and remain hopeful without overpromising. I often think of, there's an artist and she's a musician, has this quote I often use, and her name's Laurie Anderson, if you've heard of her. And she has this quote that if you think technology will solve your problems, you don't understand technology and you don't understand your problems. And I just love that because I think it just speaks to the essence of what we're tackling in healthcare. Yes, technology can help. In some ways, technology can help dramatically, but our problems run much deeper. I mean, you look at things like clinician burnout. Yes, AI scribes are great for unburdening some physicians from all the documentation challenges, but that alone is unlikely to transform doctors who are unhappy with the practice of medicine or feel like they're underwater to feeling like, oh, this restored my confidence in why I went into medicine. And there are many, healthcare access in many of our communities, people wait weeks to months to see the right physician. And AI can lead to some increased efficiency and some improvements in access, but it's not suddenly going to solve access problems. And any dimension of healthcare where there are challenges, I think AI and digital technologies can help, but they're unlikely to fully solve the problem. So I think that's what we need to focus on is this, let's be optimistic because we should be, there's great opportunity here. And at the same time, let's not oversell this as a magical solution for these deeply rooted problems.
I've used that technology understanding quote in the past, but just have said it. Now I have attribution. So Laurie Anderson. So thank you for that. I'll make sure I give her credit going forward. But it's so true. And as you were talking, I was thinking, I have never regretted spending time to really optimize a process before applying tech to it. But I have regretted more times than I care to admit where I've short-circuited that step and applied technology, and I've just amplified a bad process. And it gets back to the core of that quote is just slow down. And we have certainly in our shop, we feel an urgency, especially if a clinician comes to us with a need. We want to help. We want to make their life better. And sometimes that well-intentioned desire can cause us to skip steps that actually make the problem more challenging and less likely to be solved in the future. So a good reminder.
Totally.
Okay. With your lens as a physician and a system thinker, where do you see AI making the most meaningful impact in the next 1 to 3 years?
That's a great question. I guess the easy answer is it depends. Where, I think it's already making an impact. And the initial view of AI in healthcare is there's just a lot of drudgery, right? There are a lot of parts to our jobs that are difficult, not necessarily rewarding, but just something we have to do. So the initial emphasis, I think, has rightly been on automating some of these activities and offloading some of this drudgery like clinical documentation. And it makes sense to start there because these are lower risk areas and people are really eager to give a lot of these activities up. So I think, right now we've clearly seen AI scribes as the leading clinical facing use case. I'm particularly excited about AI to democratize medical knowledge and either internal knowledge within your system, servicing protocols and pathways and things that people may not be aware of, but even more so accessing the medical literature, right? Which, depending on the estimates, some people suggest it doubles every 73 days. That's one study. I think that's wildly too aggressive, but the medical literature probably doubles every 5 years or so. And it's almost impossible to keep up with. So I think that's a tremendous opportunity to harness the power of AI to help surface the right information at the right time and combine that also with, all the predictive algorithms we have. Ultimately, I think AI is about making better decisions. So offloading some of the drudgery, noble goal, certainly welcome that. But ultimately, I think the question is, how can we use these tools to make better decisions, to make better predictions that we can apply judgment to access information, whether it be through the medical literature or through, complex patient medical records that are too hard to summarize in a reasonable time frame. I think that's ultimately where I hope we're going, is about improving medical decision making and organizational decision making as well.
Yeah, you sparked a thought for me. And your last comment, we're so data rich, but maybe insight poor. So I think this can help there. What about pre-charting? In my mind, that seems like that could be a great AI use case. but I'm
Yeah.
probably overly enthusiastic about it. What are some of the cautionary perspectives that we should bring to that opportunity?
If last year was the year of the scribe, this year is apparently the year of the agent, according to Y Combinator. But I think in healthcare, these will be the years of summarization. Because as you know, healthcare, there's just too much data to process. We're estimated to produce 30% of the world's data. Hospitals like yours and mine are estimated to produce 50 petabytes of data each year. I have my notes here. Like, that's equivalent to streaming a 2-hour movie 25 million times. Like, that's just like, no, like most of that is obviously digital exhaust that no one's going to look at, but there is some value there. There's a study from Penn showing the average medical record is longer than half the length of Hamlet, which by the way is Shakespeare's longest play. So like, there's just too much data and information. And I often look back to a quote that this guy, John Naisbitt, said, and E.O. Wilson, the Harvard biologist, later kind of rephrased it, but we're drowning in information but starved for knowledge, right? We're just overloaded. So I think that summarization, whether it be pre-charting, because specialists like me spend a lot of time before seeing patients digging through their records, which are often stored in PDFs that are not easy to search, and sometimes they're upside down and they're poorly labeled. So I think whether it's a specialist preparing pre-charting or it's an inpatient physician or nurse who's taking over care of a patient, I think summarization, really clinical summarization, is a massive opportunity that I will go on the record and say it's, in my mind, a bigger opportunity than ambient documentation. Of course, these technologies will all converge, so they're a bit artificial, these distinctions, but I'm with you, Reid. I think this is a super ripe area for applying AI. In terms of your question with the cautionary tales, I think the challenge with this is accuracy. One of the things, these medical records are so long, you can't just stuff them all into the context window and expect to get high quality output. So there are different strategies that can be taken to, break these down into different chunks and then resum. So I think that's one challenge. But the longer the documents, the harder it is to accurately summarize. And while everyone's worried about hallucinations, right? Saying a patient has diabetes when there's diabetes nowhere to be seen, that I'm not so worried about, because the better companies doing this make all their summaries traceable. What I'm more worried about is, what if a summary doesn't surface important information you need to know and would have found if you did it on your own? What if you're an anesthesiologist preparing for a case and the summary doesn't show that the patient had pulmonary hypertension or an echocardiogram last year? That could be a big deal if you start relying on these tools. So I'm more worried about errors of omission, I guess, than commission. But I think these tools are rapidly improving and advancing. And, we're lucky. There are several solutions on the market that are quite good that I've had a privilege of looking at. And I think this is going to be a big potential benefit from AI in the near future, not years from now, like coming soon.
Yeah, agreed. And your comment about convergence, I think your ambient listening vendor, whoever you have, like, you should be pushing for this platform, because they should be able to do not just the AI node, but the coding on the back end, the pre-charting on the front end, maybe things beyond that. So that's when you get really that flywheel benefit.
Right. And if you look at like the published experience so far on ambient notes is pretty underwhelming. Like, to overgeneralize, I don't know what it's like at your health system. We've been thrilled with it at our system, but if you look at the data that's been published, including out of, Permanente Medical Group's, the largest experience, 10,000 physicians over a 13-month period, only 1 in 3 clinicians actually used the scribe more than 100 times. So only about a third of clinicians use these tools. And these tools only save on average, like less than 30 to 40 seconds per note. And they're not really cutting down on after hours documentation time. That's not to say they're worthless, because the clinicians who use them love them, right? They're really excited to use them. They seem to reduce cognitive load. They seem to reduce burnout. So certainly benefits, but the benefits are pretty circumscribed. And I believe it's because note writing, well, first of all, conversations only inform about a third of the clinical note, less than the inpatient world, less for certain specialties. So the ambient scribe solution's only informing a part of the note, and the note is only a part of the workflow. So the better scribe products are moving into other areas like diagnoses and summarization and coding and all these other types of activities that I think by bundling it all together, it'll be a better user experience, but also it'll move the needle a bit more in terms of efficiency and effectiveness.
We're getting short on time. I'm just going to plant a seed for maybe a future conversation that you and I have, but you were describing potential errors. I think it's an interesting concept to think through the human psyche. and the risk tolerance we have for a human-induced error versus a machine-induced error, and predictability, impact, how we might investigate root cause. So that's an area as well that I'm just thinking about, and how do we lead our team through those kind of conversations, and how do we then share that information with the incredible human beings that we care for? It's just an interesting topic that we can't unpack today, but maybe you can post about it and teach us all your thoughts on it.
No, I would love to discuss that another time. I mean, in brief, we have to admit we're imperfect, right?
Yes.
Like base case is not perfect. Just like there's great parallel to autonomous vehicles, right? Like autonomous vehicles seem to be safer than human drivers, but if they crash, it's the front page of the news, and we lack the appropriate accountability frameworks for these tools and the regulatory frameworks. Because you as CIO, you don't want to end up on the cover of the Boise News and Observer. I don't know what it's called, what the Boise newspaper is, but that's probably really high on your priorities as a CIO. So,
or my CEO to end up on there. Like that's also high.
Right. Wouldn't be good for your CEO either. So yeah, but at the same time, we have to admit we're imperfect, and humans alone, we have bad days, we have bad moments. We're not all, half the doctors are below average by definition, right? So we need to approach this with humility.
Yes, well said. Okay, so to be continued on that topic. That'll be great. Last question, kind of a wrap up one. A recommendation you have for our listeners, a book, article, a person, someone that's really helped shape your thinking about AI in healthcare.
I read a book before, the generative AI boom. I think it came out of maybe 2018 or 2019, but it really just kind of floored me in terms of its impact and just really opened my mind. I knew a bit, but this kind of reframed my whole perspective. It's by Melanie Mitchell, who has been working in the area for decades. And she wrote this book called AI, A Guide for Thinking Humans. And the take-home message of the book is that we humans tend to overestimate the capabilities of AI, and we underestimate the complexity of our own intelligence. Like we're very quick to call a machine super intelligent, and we're kind of quick to also say we're not intelligent. But what she argues in this book fundamentally is that we're a lot more complicated than we seem. And these tools, although they appear like magic, they aren't necessarily so. So I'd recommend that as one of the most, I read a ton, I speak to a lot of people. I'm very lucky that I get to go down these rabbit holes, but that's one that I would certainly recommend as a cautionary, mildly skeptic, but I think grounded in reality take on this whole crazy world we're living in.
Perfect. And we are imperfect, irrational beings for sure. And so that flavors all of this. Listeners, I encourage you to follow Dr. Spencer, DORN, on LinkedIn and get engaged in the conversation. It elevates our community. Spencer, thank you. It's been a lot of fun. I appreciate you, and best of luck with your future AI endeavors.
You too, Reid. Thanks so much. This was fun.
Thanks for listening to this week's Town Hall. A big thanks to our hosts and content creators. We really couldn't do it without them. We hope that you're going to share this podcast with a peer or a friend. It's a great chance to discuss and even establish a mentoring relationship along the way. One way you can support the show is to subscribe and leave us a rating. That would be really appreciated. Thanks for listening. That's all for now.